One of my areas of expertise in my clinical practice is treating OCD. And far too often I've had patients come to me after years of mental health treatment, sometimes even decades, and they still feel stuck in their anxiety and various mental health symptoms. When most people think of OCD, they think of the common depictions from movies, TV shows, where people are recurrently washing their hands, being germophobic, perhaps checking the stove, or if the door is locked multiple times throughout the day. So those are the cases that are really easy to spot because they're very evident compulsions associated with them. It doesn't take a brilliant therapist or psychiatrist to diagnose that. And while those forms of OCD are very distressing and very real for people, and I treat them all the time in my practice, today I'll focus on the more subtle and less commonly uncovered form of OCD. That's pure O OCD, or the obsessional variant of OCD. Because those obsessions and compulsions all live in here, and you can't see them. They can look like recurrent worries about something, these recurrent mental loops. They can have you analyzing your feelings, questioning your morals, seeking reassurance from yourself or others. And to some degree, we all experience this. It's just an OCD. This becomes very dominating of your thoughts and causes a lot of distress and takes up a lot of mental real estate during your day. It can also, of course, ebb and flow. So people can have days where they have a lot of these symptoms, a lot of these struggles, especially if something's triggering it in particular, and other time periods where they can feel completely free of them as well. Funny enough, I now find myself obsessing over my original explanation of what intrusive thoughts are and pure OCD in general. So I think I can do a more succinct job on my second take here. Bear with me. The way many of my patients describe their experience of OCD is having this recurrent anxiety. And it can oftentimes be characterized by a doubt around something, an uncertainty, something you hold dear, something really important to you. And it triggers this thought, an anxious feeling that comes with it. And it feels very uncomfortable, very pressing. And they'll experience this high urgency over needing to know a resolution to it, right? Because they feel like something bad's about to happen, like something bad is happening, and they really need to know for certain that they're safe, that they're going to be okay. So there's a thought, an anxious sensation that comes with it, and then this high urgency around it. Your brain's telling you, pay attention to this thought. It's very important. It holds a lot of meaning for you, and you have to have some sort of resolution now. Of course, as you can imagine, it can be very distressing, very uncomfortable. And very briefly, I'll go over some specific examples that come up often, but it's definitely not limited to these because pure OCD can attach to any sort of life anxiety you may have. And that's one of the interesting things about treating it is that there's an infinite amount of manifestations it can take. So first off, relationships, right? That's the thing people hold very dear to them. So OCD can infect that. It can have you questioning, are you in the right relationship? Do you love your partner? Does your partner love you? Were you good to your friend? Were you good to your family? Do they hold resentment against you? And it becomes very, very gnawing sort of anxiety. Finances as well, right? This high anxiety over, will I be safe financially in the future? Am I about to make a mistake that's going to ruin everything? Or safety, is something bad about to happen? Am I about to experience a major life-altering event for my health, my family's health? Am I potentially going to have some sort of illness? And how will I ever handle it? Or even questioning, are you experiencing this very moment in the way you're supposed to be experiencing it? Are you overly conscious of your own thoughts, sensations, to a point where you're even questioning them? It can also involve sexuality, questioning whether you're straight or gay, or questioning who you're attracted to. Even like certain taboos come up, right? Like, am I attracted to really elderly people, really young children? And of course, the patients are not, but the worry about am I not comes up. There are many, many more examples than that. Those are just a few that come up most commonly. And along with all those come up some mental compulsions as well. And this can look like asking yourself, am I really feeling this way? Am I really attracted to this age group, this person, or am I not? Did I make a mistake? Am I about to have everything fall apart? Am I in the right job, the right career? Is this right for me? Is this wrong for me? Of course, reassurance-seeking can come up a lot. That can be things like, asking ChatGPT over and over again, am I doing this right? Is this how I should be feeling? Am I on the right path? Asking friends that, and oftentimes my patients will tell me, my friends or my family, they're tired of me hearing about, me asking them, am I in the right job? Am I on the right path? All of these different things. That's just a quick overview. Hopefully I did a little more succinct job than my original rambling about it. So let's get back into the video. Then this takes me to my next point of why is this form of OCD so often missed? Well, as I just mentioned, right, these are things that are very internal that occur inside your mind and oftentimes feel very private and are laden with a layer of shame as well. So people often aren't eager to talk about this. And another reason it's often missed is just misdiagnosis. Too many times I've seen well-intentioned therapists and psychiatrists see a patient for long periods of time and they see a certain symptom, a recurrent anxiety for a patient, and they may not be fully versed in assessing and treating OCD, so they may misdiagnose it as depression with anxious features, a form of generalized anxiety disorder, sometimes even delusional disorders, psychosis, bipolar disorder come up as diagnoses, trying to fit a diagnosis to their experience, which seems very off and unusual. The next one that I see that is dangerous for people too is getting stuck in therapy rabbit holes. And what I mean by that is patients seeing a therapist, sometimes for years, and they're talking about their intrusive thoughts and trying to find meaning around them. Why are they experiencing this? What sort of early life experiences led them to have this experience? And how can they create meaning around this? And this is just the worst for patients. So let me explain. In OCD, talking about thoughts, exploring the meaning behind them, and where they come from, all that does is feed the obsessional thinking further. In the moment, it may feel like you're exploring something, getting to the bottom of something. But again, that is just a mental compulsion. Analyzing these thoughts, creating meaning around them. And that's what the OCD wants. That just feeds it. That's fuel to the fire of obsessional OCD. And talk therapy advocates for that. Oftentimes patients will tell me, they go into a therapy session and they really get into these thoughts. What are they worried about? And they get some brief relief. That's, again, it's almost giving some reassurance to these thoughts of the anxiety that I need to pay attention to this worry, this anxiety. And when I do, it kind of almost scratches an itch of, okay, I'm addressing it, I'm resolving it. They might even leave the therapy session feeling a little bit better, like they got to the bottom of something. But then later in the day, later in the week, again, the anxiety, anxious thoughts come up, the intrusive thoughts come up. And they're again trying to journal about them, ruminate around them, and they're stuck in that same cycle. And this can go on for weeks, months, years. I feel like I'm really roasting regular talk therapy here, but I think regular talk therapy is very useful for many people, and of course it can be very beneficial in figuring out a lot of psychological underpinnings and just resolving a lot of issues in your life. What I mean here is if you're using only talk therapy to treat OCD, and either the therapist or the patient is aware that OCD is the primary issue going on, that's where people run into issues. Because then unwittingly, you are just ruminating. You are just engaging in basically these mental compulsions out loud with your therapist. You're giving them further credence. And that's not useful to anyone. Just wanted to clarify that. So what are the lessons I've learned from treating OCD, especially the obsessional variant, that can be then extrapolated to just about any other anxiety out there? So first off, the trap of certainty. OCD always feeds on our need for certainty. And the more we fixate on finding the certainty, finding either in therapy, trying to work on these things, find some certainty, find some resolution to the psychological suffering, or ruminating in our thoughts and our journals, all of that feeds it. And that feeds almost any anxiety out there too, not just OCD. But luckily there are some great tools to combat the traps of uncertainty or reassurance-seeking. That's embracing uncertainty, being okay with sitting with not knowing something, being okay with being uneasy about a certain outcome, a certain experience being not fully knowable. And that's the key not just for OCD, but any anxiety really. And the two major treatments for OCD rely on this principle of embracing uncertainty, of being okay with sitting with it, and teaching your brain and your mind that you can tolerate it. You'll survive the uncertainty. You don't need to know right now, right this moment, outcome of something or be certain about something. You can tolerate uncertainty. There's two therapy modalities that focus on this are acceptance and commitment therapy, or ACT, along with exposure or response prevention therapy, or ERP. So all of a sudden, we don't work on exploring this anxiety, this doubt. Now we focus on, okay, that doubt's there, but we're not going to explore it. We're not going to give it the fuel to the fire of needing certainty around it, of having to talk for a resolution, or is this right, is this wrong, is this how I really feel or not? We're not getting into that game. We're going to accept that this is a concern we have, this is an anxiety that we have, maybe warranted, maybe not, but we are not getting into the game that OCD wants us to play, of checking in on that, of analyzing it, of just struggling with it. Because the more we do that, the more we fuel it. Instead, anytime life throws uncertainty at us, some anxiety, we're like, okay, we'll do what we have to do to address it when the time comes, but we're not gonna do anything more than that. Instead, we're gonna allow that uncertainty, that anxiety be there. We're gonna let it sit. We're just gonna treat it like background music. And over time, working with a therapist, you can tailor a treatment plan of how to tackle these things, of what are some of the specific ways this manifests in your life, what are some strategies you can use that are effective and proven to help manage and not interact with that anxiety, so that over time, your brain learns that, hey, I don't need to pay so much attention to this. I can just have it come up and have it leave just as easily. So to finish off, OCD, especially the obsessional variants, are oftentimes the most misunderstood and the most missed mental health diagnoses. Underpinning OCD is this need for certainty. That's also the underpinning of most anxiety in life, but the mental trap inherent in it is the more we seek out that certainty, the more we become dependent on it, the more we feed our anxiety, the more room we give it, the more space we allow it to take up in our minds. Because if we can learn to live with the unknown, sit with uncertainty, then life all of a sudden becomes much less daunting to us. Anxiety's grip over us starts to loosen. Whether you're struggling with anxiety, OCD, or just regular stresses of human life, right? I hope these skills, these insights give you some sense of agency to be able to sit with uncertainty, view anxiety a little bit differently. Hopefully have some compassion for yourself as well, because these are not easy things to do. So if this resonated with you, definitely leave comments down below. I'd love to hear your guys' experiences and thoughts on this. Thank you so much, my friends. I really appreciate you watching to the end. I hope you found this helpful. Please like and subscribe. Still a new channel, so I'm definitely eager to grow it more and educate more people about these topics. Thank you so much. I'll see you next time.